Hello everyone, once again welcome to my Oet channel. Today I will give you a small tip regarding the Oet writing. In case if you got two conditions in your introduction, that means in the case note, if you have two important conditions, you could not exclude any of this. Example, I will tell you. The patient have urinary tract infection as well as orthostatic hypotension. So maybe in your case note, you can find out urinary tract infection and they have started already the antibiotic. But now patient has found to have orthostatic hypotension. So upon discharge, the current status will be recovering from urinary tract infection, but still he has orthostatic hypotension. So sometimes you could not find out regarding the hypotension. Maybe you will not think about, even if you will not think about this condition has to be written in the introduction. So how you can find out means you can see the writing task or the discharge plan carefully before writing the introduction. Okay, because from there you will get the current status. And if they have given discharge plan or recommendation sentences regarding two conditions, that means currently patient has these two conditions that has to be mentioned in the introduction. So how you can write it in the introduction? As usual, you can start like I'm writing to refer, or the purpose of this letter is to, something like that. But when you will come to the diagnosis, or when you will write the medical condition, you have to mention both. Example, he is recovering from urinary tract infection and has orthostatic hypotension. So these two conditions has to be mentioned. Then when you will come to the present medical paragraph, always I am suggesting you to write two paragraphs. Okay, not more than two. So if you have two conditions in introduction, one paragraph you can consider completely for one condition and the next one is for the second. Example, you can start with the admission, signs and symptoms, and the urinary tract infection. The urinalysis confirmed urinary tract infection, and what are the management he has been received. So mostly who is recovering from urinary tract infection, if you wrote like that, of course you have to write it in the present medical paragraph like this: he has been commenced on. So you can mention the antibiotic name which needs to be continued. So that means still he is on antibiotic. Okay, don't forget the term has been. Then in the next paragraph, you can mention regarding orthostatic hypotension. So you can just mention like subsequently or gradually or consequently, patient, you can mention the name. Then what is the things that happen and how you found orthostatic hypotension. So it will be very clear for the reader to understand presently patient has these two conditions and what is the current status. You have to end up with the current status. Okay, so when you wrote about the UTI, it is clear that still he is on antibiotics, so which needs to be continued, that is clear. And when you will write about the BP, regarding the blood pressure, you have to mention it, what is the current situation. So it means that currently still he has orthostatic hypotension. So in recommendation paragraph also there will be some plan or some instructions will be there. So in the conclusion, I mean in the conclusion of the paragraph of present medical, you have to mention what is the current. Okay, if it is a suspected case, you have to write that which aroused the doubt of his or her possible diagnosis. This sentence you can by heart and you can use it for all suspected cases after clinical features. Okay, and if it is recovering, you can write even though he made progress. Don't use the term good progress, because if it is still, if patient has the condition, how you can tell that patient has good progress? You can just mention even though he has progress, comma, he requires further attention at your facility or from your facility. So something like a small conclusion you can mention there. So always try to find out how many conditions, current status, it is current status patient has, and write in the introduction the condition how to be written separately in the present medical paragraph as two separate paragraphs. Okay, this is like normally, but in some cases two conditions will be there, but it will be correlated, like one and the next will be correlated. Example, if we have one letter like Jake Peterson, there actually the patient has recurrent alopecia associated with increased anxiety. So this is both, I mean, these are both interrelated condition. In such case, I'm not suggesting you to write it like a two separate paragraph, because one came because of the other one. Okay, so in this case, you can just write togetherly. But most of the cases, if it is like a separate example, Parkinson disease and bunionectomy, like right foot bunion, delayed wound healing, and Alzheimer's disease. These are all totally separate conditions and need separate management. Already they have undergone separate management, and even in the recommendation paragraph, there will be separate criteria to treat the patient. So find out and write it wisely, because nowadays you are getting such type of questions. Okay, so always try to keep it in your mind how to organize your letter, especially your present medical paragraph, because many of you will lose marks only because of introduction and present medical paragraph. So take care. And if you need to know regarding the updates and the current questions and all, you can go to the playlist, my YouTube playlist, and there you can see the introspection, Oet exam introspection and Oet letter separately. Okay, or else if you want to get the corrected letters with the question paper along with Oet like basics and Oet grammar, there is my guide. So you can see the end of the video. So I have given the advertisement, so you can see the details. And if you need letter voice correction, it's not class, it is voice correction, you can contact me in my WhatsApp number. I will post it in the description box, and I'm here to help you to get your desired scores in Oet exam. So I hope this video is useful for you. We will meet with another one informative video. Until then, bye. Take care.